This presentation is for vets and vet-led teams carrying out the Animal Health and Welfare Pathway Annual Health and Welfare Review for pigs. Content contains specific guidance on health and welfare aspects of the review and is intended to provide a useful overview of requirements for vets working solely with pigs and details on resources useful for vets who do not work exclusively with one species. Some slides may be useful to share with the wider practice team, where they are supporting you in delivering reviews on farm. The Annual Health and Welfare Review gives vets the freedom to decide with farmers where to focus. As such, vets are incredibly important to the success of this programme. The content of this presentation covers where to find official and practical guidance, details of the review and report requirements, suggestions for pig-specific health and welfare areas you may wish to consider in your review discussions, your recommendations and report requirements, farmer funding opportunities, tips to prevent issues, and where you can get further support. Links to useful resources which are provided within this video can be accessed in the YouTube description box below the video. You will need to exit full screen view to see these. These links are also provided on the AHDB web pages. We recommend watching this video in full before dipping into any additional resources you may require. The video is broken down into chapters with a unique reference number for each resource. For example, here 1.1 relates to Chapter 1, Link 1 in the Resources list. Resource links will open in a new window. Official guidance on the Annual Health and Welfare Review can be found on the government web pages. These pages provide information for farmers on the eligibility criteria, plus a 7-minute video demonstration on how to apply and how to claim payment. This video may be useful for the practice team to watch if they receive calls from farmers with queries about the review process. For vets, the web pages provide guidance on how to carry out the Annual Health and Welfare Review, plus specific requirements for disease testing. It is essential that the official guidance is followed to ensure that farmers are able to claim the payment. If you or your clients have any queries on the Annual Health and Welfare Review or the wider Animal Health and Welfare Pathway Programme, you can contact the Rural Payments Agency. Contact details are on this slide. There are 5 separate 20-minute videos in this series designed to cover a mix of official and practical guidance on different aspects of the Annual Health and Welfare Review. This industry guidance should be used in conjunction with the official guidance and is not intended to replace it. Each of the 5 videos is divided into chapters to enable you to dip into relevant sections. The first 3 presentations cover species-specific guidance on health and welfare aspects for pigs, sheep and cattle, both dairy and beef. The final 2 videos cover biosecurity and details of the disease testing required for the review, with content split by species for user ease. Farm Vet Champions, provided through RCVS Knowledge, contains over 20 hours of continued professional development, or CPD, to support and empower vets to tackle antimicrobial resistance with online tools. There are 3 mandatory elements to the Annual Health and Welfare Review: a vet visit to the farm, porcine reproductive and respiratory syndrome blood testing, and 2 reports: a written report for the farmer providing recommendations and actions, and a summary report which the farmer will use for audit purposes as evidence the review took place. Details of these are given later. These compulsory elements enable the farmer to claim the review payment. Specific requirements for PRRS testing are detailed in the disease testing video within this series. All aspects of the review are designed to be for the farmer and herd benefit, not for inspection or compliance. The review is intended to provide additional vet-led input beyond the current level on each individual farm. Content of the review is otherwise flexible to allow the review to concentrate on individual farm needs. The review can be carried out at any time to suit you and your client. You may wish to consider the following when planning diary dates: the convenience of having another member of the team take blood samples, the seasonality of PRRS and whether disease testing may be more appropriate earlier or later in the year. Pigs can be sampled at any time, but there are a greater number of diagnoses during winter as the virus likes wet, cool and dark conditions. Transmission tends to increase in winter as the weather can cause challenges with cleaning and disinfecting housing, equipment and transport. You will need to discuss test results with the farmer and make appropriate recommendations, so it may be preferable to separate your sampling and review meetings. The sampling visit could offer an opportunity to suggest what documents or material you might like the farmer to have to hand to aid discussions at the later meeting. An important point to note is that the farmer must submit the claim within 6 months of application. The farmer can apply for subsequent reviews of the same species every 10 months. At the end of the review, you must agree actions and recommendations with the farmer and produce 2 reports. These can be in electronic or paper formats. The written report described on the left of this slide is for the farmer and herd benefit. It is not shared with DEFRA and will not be used for any regulatory or inspection purposes. The report can be a standalone document or included as part of another document. Wherever it is recorded, it must be clearly identifiable as annual health and welfare review information. This report should include the PRRS test results, your advice and recommendations, and agreed achievable actions. It should be reviewed each year to encourage progress. The summary report provides evidence that the review took place. The farmer will need to provide this to the Rural Payments Agency for auditing purposes. The summary report must include the agreement number from the Rural Payment Agency application, the farm business name and single business identifier or SBI, the date of the last visit for the review, type of livestock, confirmation that 51 or more pigs were present at the review, confirmation that the PRRS testing was carried out, the laboratory test unique reference number or URN, your name and RCVS number, confirmation that the farmer has been given a written report, and your signature dated. Vets working solely with pigs will need no guidance on suggested focus areas for health and welfare in pigs, but for vets who do not work exclusively with one species, the following industry priorities and resources may be of interest and support you in your on-farm review discussions. Although African swine fever is covered in the biosecurity video, it is of such major concern to the pig industry it is reiterated here. Evidence shows that the biggest risk is contaminated pork products being eaten by a pig. This could be scraps from a kitchen or even a careless throw of a sandwich into a pen of pigs. Ensuring producers are feeding specially formulated commercial pig feed is key. AHDB has lots of resources on ASF and biosecurity, including ASF resources that are available in several languages. ASF is present in many European countries as well as further afield. It is therefore useful for farmers to consider where staff and visitors to the farm have travelled from and how biosecurity can be tightened. A key long-term objective for the pig sector is to get all pig producers recording antibiotic usage in the electronic medicine book for pigs. This tool is a UK-wide service for the collection of data on antibiotic usage in the pig sector and, optionally, the full legal medicine book for pig holdings. It demonstrates responsible use and is therefore of a reputational benefit to the sector. Currently, the dataset represents 94% of UK pigs, and the desire is to get 100% coverage. Red Tractor assured pig producers will already be entering data into EMB, as it is a Red Tractor requirement. If your client is not recording antibiotic use in EMB, the review offers an opportunity to encourage uptake. Instructional guides and video demonstrations are available on the EMB web pages to guide you. The review also presents an optional opportunity to review other areas of medicine use on farm, such as vaccine plans, medicine use, storage and administration. For some, advice or training in these areas may be useful. The review could provide an opportunity to promote culture and sensitivity testing or look at areas where there is relatively high antibiotic use. Species-specific codes of recommendations for the welfare of livestock provide a practical interpretation of relevant legislation. The legislation requires that any person attending an animal must be acquainted with the relevant code of practice, have access to the code whilst attending the animal, and have received instruction and guidance on the code. It is therefore a good idea to ensure the farm has the most recent copy of the Code of Practice for Welfare of Pigs handy. This was updated in 2020 and provides a useful source of advice. Other suggested areas identified through government and industry partnership working include porcine reproductive and respiratory syndrome, biosecurity for endemic and exotic diseases, welfare handling training, tail biting and sow confinement during farrowing. You may wish to signpost farmers to the UK Pig Industry Welfare Training Platform on the AHDB web pages. This provides a refresher tool for experienced stock persons as well as upskilling new entrants. AHDB's Tail Biting Web Hat resource is an interactive tool providing information on the key risks for tail biting and practical suggestions to help reduce these risks on farm. As part of the review, you must set agreed achievable actions with the farmer, tailored to the individual farm with clear targets. These must be reviewed at the next annual review, if not before. Your advice, recommendations and agreed actions must be included in the written report you provide for the farmer. Based on individual farm needs, you may wish to set some easy wins and stretch targets. As per previous slides, a relevant grant opportunity may assist. When you agree actions with the farmer at the review, encourage them to consider if grants offered by the government could help them in carrying out these actions to achieve health and welfare improvements. Grants provide up to 40% of the costs, are accessible to farmers that are not in receipt of the Basic Payment Scheme funds, and to farmers with or without an annual health and welfare review. However, applications for grant funding that demonstrate genuine need for specific pieces of kit following advice from the vet and are linked to an annual health and welfare review are viewed advantageously. Two types of grant are offered through the pathway: farming equipment and technology grants and infrastructure grants. Both are part of the Farming Investment Fund, and details can be found on the Farming Investment Fund gov.uk web pages. The Farming Equipment and Technology grants provide match funding for equipment and technology items which improve the health and welfare of sheep, pigs, dairy and beef cattle, laying hens and broilers. Infrastructure grants fund transformational projects that enable farmers to achieve higher levels of animal health and welfare. The initial offer co-funds new and upgraded calf housing to improve social contact and the ambient environment. In time, the offer will be extended to include grants for adult cattle, pig and poultry housing. Farmers need vet advice to apply for this grant. The Annual Health and Welfare Review provides this. For the latest updates on both grants, follow the DEFRA Farming blog. Further government funding to prevent and reduce endemic diseases and conditions will be available in 2024 through disease eradication and control programmes offered through the pathway. We have included some tips to help prevent potential issues on farm, with the lab and in your discussions. On farm, potential issues include selection of the wrong animals or test, the wrong number of animals or too little blood. For animal selection, please refer to the flowchart in the disease testing video. In vaccinated herds, the ELISA test is unsuitable and PCRs must be used. You must blood test 30 animals and the blood volume provided should ideally be 3 or 4 millilitres per animal. At the lab, potential issues include postage delays due to strikes and missing or incomplete sample submission forms. Please use the bespoke laboratory submission form and complete all sections. Finally, when planning review discussions, do you have all the necessary information and knowledge? Do you have a plan for next steps? And are there any unexpected test results? The laboratories will be able to provide guidance if you have any questions. A number of organisations are supporting the rollout of steps within the animal health and welfare pathway and are providing material to support both farmers and vets. The organisations on this slide are useful sources of advice and technical guidance. For support with effective communication, it is worth knowing that Farm Vet Champions provides vets with 3 hours worth of CPD divided into handy bite-sized sections. A reminder that if you or your clients have any queries on the review or the wider animal health and welfare pathway process, you can contact the Rural Payments Agency. A quick continued professional development reminder to add 20 minutes to your CPD record after viewing this presentation. Add additional time if you viewed other presentations in this series or clicked into further resources. The RCVS 1 CPD link has been included on this slide for quick access. Thank you for watching this video. If you have a spare 20 minutes now, you could follow the resource links on this slide to view another video in this series, or dip into resources on the RCVS Knowledge Farm Vet Champions website.